Welcome to the Fibro Man Channel. Today we're going to take a look at the purpose of the Fibro Man Channel and basically have 5 points that, at least at this time, that I want to cover. The first thing we've already started on, which is defining fibromyalgia and symptoms. So if you haven't watched those first few videos, please go back and review those. So define fibromyalgia and symptoms. So we've went over some of that in the previous videos, and later on we'll take a look into other chronic pain conditions and symptoms. And but for right now, I'm going to be a little bit more specific. The second thing is preventive. This is very vague, and it may be a little new when it comes to information, especially regarding fibromyalgia and other chronic pain conditions, because it may or may not be possible. So it is very vague. However, the only thing that we can control is ourselves and where we are in whatever position that we find ourselves health-wise. So we want to take a look on how to better care for our mind and our body, and preventive is something to look into, I firmly believe, because as I look back, I think I may have had opportunities that I missed to be a little bit more preventive in my life. So we're going to take a look at that, and on a physical level and on an emotional level, with especially dealing with stress. The third point is management, which includes education and support. This is probably the biggest and ongoing part of what the channel is about, is just kind of learning what works. I'll share some things that have worked for me and that works for me. If you have fibromyalgia or chronic pain, you understand what I'm saying, that changes, So a lot of things change. If something works for you at one time, it may not work for another, so you have to keep experimenting. But let's share what works for you and what's working for others, and see if we can find some common denominators there that others may be able to try, that maybe something that you've never thought of before. So let's think of it that way as we get into management and share stories and things that may at least help a little bit. Sometimes that's all you're looking for, is just a little bit of improvement. Is obviously better than none. There's definitely no one size fits all. So we'll explore that area very closely. The fourth point is encourage others who have chronic pain conditions, so we can encourage each other and show love and support. I think it's important to raise awareness and promote that support for individuals with chronic pain conditions. So you'll see on my website the Fibro Man Fibromyalgia banner, and join the Purple Ribbon movement. May is the month for fibromyalgia awareness. I believe it's May the 15th. I may be quoting that, but is the fibromyalgia day. I know it's close around that, but I think it's something that should be all the time, because chronic pain doesn't stop, does it? So we need to continually be aware of those individuals who are dealing with chronic pain, and those of us who have chronic pain certainly want to be a support to each other. Then the fifth and last part that I just think is huge, and that's having hope, because when you go to the doctor and you're sent for multiple testings and lab work, and you get bounced from one doctor to another, you're just looking for some type of hope to feel better, right? you know what I'm talking about if you're an individual with chronic pain. And individuals with chronic pain have a special superpower to go with the Fibro Man theme. We have a special way that we recognize each other, don't we? We recognize other individuals who live their life in with chronic pain. Um, so the hope is just a huge part of it. Hope for a couple things. Number one is, especially with fibromyalgia, for a standardized testing. And I hope a physician or someone in a certain capacity is able to hear this, because one of the worst things for an individual is to go through this whole process of not knowing what's going on, dealing with all of these random symptoms and going from one specialist to another specialist who can't help you, and going from one testing to another testing, and it just makes you feel very hopeless, because you feel hopeful each one of those visits that they're going to figure it out. And my wife and I said that many times. We're going to the right place this time. They're going to figure out what's wrong with you. And I can't tell you how many countless times that happened, to the point that you're just numb to it. So right, I really believe it's possible to have standardized testing, especially nowadays with the information that has that's out there on fibromyalgia. If someone does not believe that it's a real condition, real disease, then they're definitely in the dark ages. So let's hope and pray for some type of standardized testing. Obviously, doctors have to be careful not to miss something. So that's something that we have to realize as the patient, that the doctors have a difficult time diagnosing our symptoms, because they want you to say, if you had a magic wand, where would you want that one place to stop hurting? Yeah, I can't tell you how many times I've had doctors say something like that, and it's like, doctor, it's everywhere. It's my whole body. It's the muscles and the joints, and it could go on and on. So fibromyalgia is a chronic and a widespread disease, and it's not just one part of your muscle or your body you can point at. So anyways, standardized testing, the last part of that is a cure. So hopefully, as medicine evolves and as the awareness is raised to what fibromyalgia is and how drastically it impacts somebody's life, there will be more of a focus in testing, and I'm having a hard time thinking of the words, but studies, things that could be done that can figure out how to reverse maybe some of the symptoms, the things that happen to us, especially in the brain. So I made this a lot longer than I intended to, so I really do apologize, but I really am passionate about this. I'm passionate about trying to help others who are dealing with this. You're not alone. I want to tell you that. And there are others out there who are going through something similar to what you're going through. And I want to encourage you to find that person out there. It was years before I came across my fibro buddy, and she is certainly special. She worked in my wife's workplace. She came in as a new employee, and as they started to get to know each other, this lady was telling my wife all of the symptoms that she had, and it was unbelievable how similar. I say that we're twins. So I have a fibro buddy, so I encourage you to find somebody like that. If you don't necessarily have fibromyalgia, find a pain pal. All right, you guys, I've talked enough. So this is Fibro Man signing out. Please check out some of my shorts, videos, not my shorts that I'm wearing. That might be a little embarrassing. But check out some of the short videos. The more that you like the videos by clicking the thumbs up, I don't want that for my ego. I'm too old for that, and I'm in too much pain for that. But it tells YouTube to send this information out to others. So it's really important to like and subscribe. Thanks for being a superhero. You certainly are, whether you have chronic pain or you supporting individuals like myself. Thanks, and have a great day. Fibro Man signing out.